Precious, are you in the right class? Hey, Precious, are you, this is community.
Yeah, that's where it should be. My things, hold on.
Do you, it says Precious Zussman on your sign-in.
Yeah, I clicked the link from my professor and it took me here, so that's what I was wondering. That's why I wasn't clicked in.
Yeah, I don't have you on my roster. Are you with Professor Kershaw?
Yeah.
Oh, okay, you're on my link. Go back to her link.
Okay.
Just go back to your announcements. You'll have that in there, or go back to the exam review. You'll have that in there. Hi, Shabria.
Hi,
How are you?
good. How are you?
Good, good, good for a Friday.
That's good.
Hi, Maria.
Hi, how are you?
I'm great. How are you?
Good.
How's the weather in Pennsylvania?
It's supposed to rain for like a week straight.
Oh,
We went we went from having nice sunny, warm weather to like kind of chilly, breezy, and rainy.
oh. Hey, Logan.
Hi.
Are you in the right class?
No, I don't think so, but I used the link I thought, but I guess I'll try another one. Thank you.
Okay. Hi, Debbie.
Hi.
Hi, Latrice.
Hello.
How are you?
Fine. How you doing?
Good, thanks.
That's good.
Hi, Jasenia. Tamara.
Hello.
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 How you doing?
Doing good. How
Good.
about you?
Doing good for a Friday. Thank you for asking. Candy, hi. Are you in the right class? Are you in Professor Kershaw's class?
I thought that I had this. I'm sorry.
That's okay.
Darn it.
No worries. Jailia, I don't know if I pronounced your name right. Why are you I don't know why I'm getting all of Professor Kershaw's. Hey, Reese, I think you're in Professor Kershaw's class, correct? Reese?
No, I'm in your class.
Oh, yes, you are. That's the name. Serena?
Yes,
Okay, sorry,
that's okay.
Serena. You're listed as Reese.
Yeah, I go by Reese.
Okay, okay, good to know. Good to know. All righty. Maria, Reese. Okay. All right. Well, I'm going to go ahead and get started. We're missing a lot of people, but I want to cover some things today. So how is everybody for a Friday? How's your week 3 been?
Pretty good.
Busy, I'm sure, really busy, really busy. We have completed, let's see. We have completed 3 weeks now, okay? And this week, hi, Brianna,
Hello.
can you come on camera, please?
Mhm.
Where are you? Brianna?
I'm okay.
Hang on, guys, let me let the rest of these students in.
That is the cutest baby I've ever seen in my whole life. She is so cute.
Hang on, just trying to sign everybody in. Okay, so week 3. You're done with week 3. So this hang on one sec. I have another. Okay, sorry, I need to. Jayla, Leah? Shanti, are you in your car? Shanti, are you in your car? Okay, I can't have, yeah, I can't have you driving. You're gonna have to get where you're going and then check
I'm not driving.
your passenger.
Yeah, that's what I'm trying to say.
When are you gonna be home?
In like 2 minutes. And I can
Okay.
get back on that.
Yeah, why don't you
I can
get
get
back on then? Okay, that sounds
Okay.
good. Thank you.
So is this not her link for
Nope,
community?
no, this isn't her link. She's waiting for all of you guys to come on.
Do you know the link that she has?
You'll have to look in her announcements. The links are in her announcements. I don't know it off the top of my head.
Okay, this is the one.
Hang on, I'm just here. I'll just turn it down.
Hey, sorry, guys. I'm not sure why everybody's coming in here. Let me. Okay. Hi, Peyton. I'm not sure. You can, whoever that is, you can mute yourself, please. I don't know how to pronounce your name. Snigdha. Can you hear me? Sorry, guys, for the delay. I'm sorry. Just trying to get everybody to the right place. Does anybody know how to pronounce this name? Snigdha? Snigdha? Okay, Maria, I can't see you on camera. Debbie, I can't see you on camera. I can only see your forehead. Okay. All right, so end of week 3. This was a review week. I didn't see much attendance. Did anybody attend any live reviews? They were Monday, Wednesday, and Thursday.
I went to one last night.
Who said that?
Me, Gabrielle.
Okay, all right. How was it?
It was good. She brushed on the stuff that we should like really focus on and went over the study guide.
Okay, great, great. Okay. Professor Kershaw is sending me her recording. I think it's uploading as we speak. So after this class, I will post her recording, and then you should have all 3 recordings for hang on, Snigdha. I think you need to be in Professor Kershaw's class. Okay.
I can't find the link.
Go back to your announcements.
Okay.
Her links are all over her announcements. So please go back to her week 1 announcement, or you can go back to the review schedule, and all of our links are on there. So if you could find her link, because you're supposed to be in her class.
Okay.
All right.
Yes.
So anyway, you'll have all 3 reviews. You have an excellent study guide. Has everybody seen the study guide? I know it's long. I get it. I have it pulled up right here. Hang on. I know it's long, but hang on. It's 14 pages, but it's also a summary. Okay. So let's just review that. I'm just going to show you this right now. I've copy and pasted all of your readings for weeks 1, weeks 2, and weeks 3 in the study guide. So you don't have to go back to the syllabus. Okay. Okay. Sorry. I still have people coming in. Okay. Okay. So, these are all topics that we've covered in class. Okay. I've covered this extensively in my review. So I highly encourage you to watch my review, watch all 3 reviews. Okay. This information in the study guide is what you're expected to know for the exam. Okay. The study guide was made up from lectures, readings in the book, readings in Canvas, your notes, your weekly notes that you get, okay, and your 2 homework assignments, your vulnerable populations discussion question and your common childhood ailments. I can tell you there's at least a couple of questions on all the childhood ailments in the study guide. Okay, so please know those. The study guide is an excellent summary. What I would suggest is, and I say this in my review, start with your study guide. It's extensive. Okay. if there are topics on your study guide, if there are topics on your study guide that you don't understand, go back in your other resources and research. Okay, whether it be your book readings, your Canvas readings, your weekly notes, your discussion questions. All right. If you have a good understanding of the study guide, you'll do excellent on the exam. Excellent. And I really encourage you all to go back and watch all 3 recordings since you didn't attend live. Okay, so that's all I'm going to say about the exam. Okay, I'll say one more thing. If and when you complete your due diligence of preparing for the exam, that means you've gone through the study guide, you've researched topics that you don't quite understand. If at the end you are still struggling with a few topics or some information in the study guide, please reach out to me next week and we'll set up a quick tutoring session. Okay, and we'll go over those areas. But I don't want to set up a tutoring session to go over the whole study guide. I'm expecting you to go through the study guide and then come to me with what topics, concepts that you're still having trouble with. Okay, and I'm happy to review those with you. Does anybody have any questions?
Yeah, you keep cutting out.
I do?
Yes.
Okay. Okay, so what, all right, so like how often, how long, because I haven't seen anything cutting out so far, so what am I, is it
Yeah,
like,
you just did.
is it like a quick cutout or is it staying on for a while or what? You're muted, Lena?
Yeah, I'm talking to another student that's here with me.
Okay. Okay, somebody needs to mute their background noise. Okay, can everybody hear and see me now?
Yes. Yes.
Yes.
Okay, am I cutting out to everybody?
Not to me, no.
Not to me.
Okay,
Lina, maybe it's the Wi-Fi at school.
what?
Maybe the internet there.
You're on the internet at school?
Lina,
Okay, well, maybe that's the issue. Because I don't know, Dorinda, well, I'm not sure, Lena, hang on. Dorinda, am I cutting out to you?
Yes, now you did.
Okay, is there anybody
I
else?
think it's because
Pardon me? I just want to clarify.
no.
I want to see what you guys are missing. Other than Lena, is there anybody else I'm cutting out to?
no. Not to me.
Okay.
No.
Lena, is there a better place that you can go in the building that you might have better internet? No?
So fine, let's go on.
No, if they would let me drive to get home, then I would have perfect internet, but it takes me an hour and a half to get home. And by the time this class starts, I'd still be on the road for 30 minutes and then you would kick me out of class. So I can't, I'm stuck. I'm stuck.
Okay. Well, maybe that should be something I try and help you with and we reach out to campus about, okay? Why don't you stay on after Lena and we'll try and help sort this out with you, okay? All right, let's get going
Because we
with
can't hear you speak.
what? I'm sorry? Okay, here's how today's gonna go. I'm sorry? Dorinda, I'm gonna mute you, okay? Because I'm getting some background noise from you. Okay, so we're gonna review our notes from week 3, okay, which covers 4 different topics, okay? And then we're going to do a Jamboard real quick for review of the topics. Has anybody ever done a Jamboard? I did this with my class on Monday and they loved it. It's just a review of everything we are talking about. Then we're gonna take the quiz, okay? We're gonna take the quiz going forward after we've covered the content. Okay? And then we'll review the quiz. So that's a plan for today. Does anybody have any questions about anybody have any questions about anything so far?
Are we gonna kind of talk about the project that we have to start?
Yeah, we could. We could at the end. Yep, you mean the group project?
Yeah, I was just wondering if it's only like one slide we have to do or a whole PowerPoint.
Oh, is this your vulnerable populations?
Yeah,
Okay, well, that's an individual project that is due in week 10, I
10.
believe. Yep. So go to week 10 to your module and look at the guidelines for it. Look at the rubric. This is an individual paper. It is a
Oh, okay.
PowerPoint and it's several PowerPoints. I think it says like 8 to 10 slides. And you pick a vulnerable population in your community within your zip code and do a research project. Okay, so go back and review that in week 9, and then please go back and review. I'll be sending out your groups in the next 24 hours, hopefully by tomorrow. Then you can start working on your group 7 project. I essentially assign each group an infectious disease, and the guidelines are right in the week 7 module of what to do. There's several questions. What is it? How is it transmitted? How is it treated? And you work on that as a group. And then everybody submits their final version.
Okay,
of
so
it.
then there's 2 different things.
Yep. Week
Okay.
7 and week 9. And then I want to reiterate, because I had some questions this week about this HESI Prep study guide. I just want to reiterate, everybody's HESI Prep guide you should be using, I attached in the week 1 announcement. That is the most updated version. The one in your week 10 or week 9 is not the most updated version. If you end up using the one in week 9, you're going to be doing a lot more work than you need to. Okay, so I said this in week 1, please make sure you're using the HESI Prep study guide from week 1 announcement. I can't reiterate that enough. Okay, I had a couple of students contact me this week and they were using the old one. It's just a lot more work. What I did at the beginning of last term is I toned it down. I took it from 9 pages down to 5 pages. Okay, because remember, these are topics that they ask you about on HESI. Okay, so the one from week 9 is from 3 terms ago, where they're not asking a lot of those questions anymore. That's why I sent you an updated version for week 1. Your week 1 HESI prep guide that I sent you is extremely specific to the last 2 terms of HESI. I can go in and see what topics they're asking you. And I don't know the questions, but I know the topics. And that week 1 study guide has every single topic that's asked to you on HESI. So now that we're done, we're going to be done with week 3. I would highly suggest that in the next week, you go through that HESI study guide and complete the parts that we've covered. Because 1/3 of that HESI study guide will now be covered. And go in and start filling that out, because that's why I wanted to make it an ongoing project for the term, because if this ends up being a blank document in week 8 and you're going to fill it out from scratch, it's going to take you a long time. And that's why I said in week 1, this is an ongoing document. This is your working study guide for HESI for the whole term. So we've already covered a lot in there, and today we're going to cover more. So if you have a minute, go in and start filling that out. Yolanda, are you in?
I'm
I
in
think-
Professor Kershaw class,
Yep, so you need to go back
but
and find,
I can't get in for some reason. It says the access not allowed or denied or something like that. I've been fighting for 10 minutes and then I thought this was better than nothing.
okay, well, okay, then just stay here, okay? If you
I
can't
don't
get
know
in,
do you have
stay,
her number?
it's in your announcements. It's in your
I-
announcements.
I
You'll have
can't
to go,
get in.
you'll have to go back to your week 1 announcement and find
I
her.
am.
Okay,
It says access denied or something. I
Okay.
don't know.
well, if you can't get in, just stay here.
I will email her though.
Sounds good. All right, I'm gonna
Thank you,
share my
sorry.
screen. That's okay. I'm gonna share my screen and we're gonna cover, so what are we covering this week? What did you guys do for prep work? What readings did we do? What populations are we talking about? Anybody?
Migrant farmers,
Oh.
poverty,
Is it-
homelessness.
Okay. So I'm gonna review our week 3 notes because that's a summary. What do we know? What did you learn about rural health and migrant health? What is rural health? Does anybody live in a rural community? What is a rural community?
Isn't that like farmers and stuff?
Very small community, right? It could be a farm, village, small town. Okay, what do we know about the rural population? Vulnerability in rural populations is very high. All right, the typical age is either below 18 or above 65. Rural populations tend to have lower education or have fewer years of formal education. And interestingly, about a quarter of the rural population, rural Americans live at or near the poverty level. And kids are very vulnerable in rural populations, right? It's estimated that 40% of rural children are impoverished. Okay, fewer people have insurance or lack of insurance, or they're underinsured. So that affects their access, right? Quite a bit of them are Medicaid or on public assistance. And they certainly work in more high-risk population or occupations. What would be some high-risk occupations in the rural community that you might be concerned about?
Farming.
Farming? Why? Equipment?
Because of
Pardon me?
the equipment and the chemicals and like
Exactly.
insect bites.
Yep. Whoops. Hang on. Okay, what am I doing here? Okay, some of the issues that rural populations have, okay? Do you think they have access to specialized care?
No.
No.
No, they don't have access to specialized care. Usually it's a family physician that doesn't have any specialties and say high risk OB, right? Or oncology or cardiology, right? Or neurology. Okay, they are, oops, sorry. I don't know what I did with this, but a lot of times in, what did I do here? All right, guys, hang on. I don't know what I did. I don't know what I hit, but now my notes are all blurry. Let me try and go out. Let's see. And go back in. 1 second. Sorry. Okay. Sorry. Week 3 notes. Here we go. Okay. One of the things about rural populations is they have much higher risks of chronic illnesses, right? They are less likely to, sorry, I've got a dog barking in the background. They're less likely to seek out preventative care. So what happens? When do we typically see our rural community with regards to illnesses? If they don't seek out preventative care, what's the issue?
It's advanced. It's a little bit too late.
Exactly. Exactly. They don't prioritize their health. Okay. They're much more likely to smoke, have higher rates of alcohol use, obesity. They don't participate in screenings or wellness visits. And we just talked about the chronic illnesses such as COPD, hypertension. Right? It's estimated that over 50% of all rural adults have some kind of chronic illness. Okay, we talked about having less access to health insurance, less access to fewer physicians, especially specialized physicians. Right? When they get sick, they have a lot more difficulty maintaining their independence.
And a lot of them have difficulty with transportation too.
Transportation is a huge issue with rural populations. Why is that?
Because is it because it's like far, or it could be far away?
Yep.
A lot of the transportation services, they don't go from county to county either. A lot of times the hospital may be in a different county that the patient lives in. Therefore, they don't cross county lines.
Yep.
Or their family lives out of town or far away.
Yep.
And they can't afford Uber, obviously.
Yep. Well, and remember too that with regards to work, most of these jobs in the rural communities they don't come with health insurance, dental insurance, vacation days, personal days, right? So if people are having to leave to go to an appointment out of town, they risk losing their pay for the day, right? And so they're less likely to do that. Okay, they definitely, rural populations have a higher infant and maternal morbidity rate, right? Especially in areas with poor physician coverage, right? There's typically no pediatric or OB specialists. So if you have a high risk OB pregnancy, you're having to travel for your appointments. Okay. I'm up here now. Rural residents have a higher rates of persistent depression, mental health issues. They're much more at risk for stress and stress-related conditions, right? Because a lot of the rural communities live in poverty. Okay, here's some of the there's 4 primary high-risk industries in the rural communities. Forestry, you need to remember these: forestry, mining, marine-related fields, and agriculture. The industries have a high risk of health risks due to, we talked about this a little bit ago, machinery, vehicular accidents, trauma, cancer, respiratory conditions, chronic diseases, birth defects, developmental delays due to chronic exposure to toxins, pesticides. Okay, extremely high risk for exposure to pesticides in the rural community. Okay, farm workers also have a lot of health risks. The biggest exposure to farmers is pesticides. I want you to remember that, because what I've highlighted here in yellow, you need to know. Okay, you're going to get asked about pesticide exposures. What does an acute pesticide exposure look like? What does a chronic pesticide exposure look like? All right, and it's all right there in yellow, but you do need to have an understanding of that. Okay, kids are very at risk for pesticide exposures, herbicide exposures. Okay. Migrant workers. What's the difference between a farm worker and a migrant worker? What's the significance of a migrant worker?
They're usually immigrants, right?
Yep. They're
They're
seasonal.
not always in one. You right.
No, go ahead.
That's what I was gonna say, and they only work seasonal, and sometimes they travel from one place to another.
Right, and they're always on the move, right?
Yep.
So sometimes it's hard to track their health. Let's say that they went to a migrant health clinic at one stop and they were diagnosed with hypertension or diabetes or something. What's the likelihood of them, going to the next place of work and them following up on that? That's why there's such a high incidence of chronic illnesses with migrant farm workers. There's lots of similarities between migrant farm workers and the rural populations. Okay, some of the differences are, right? They come, it's seasonal, and then they go back home. They're moving around a lot. They usually do not know what services are available to them. They have language and cultural barriers. They have transportation issues as well. In particular, female migrant workers have a high risk of sexual harassment or abuse. Kids have very high risks working as migrants. And a lot of times they're traveling as a family. So the parents are working on the farm, as is the kids. Okay, kids have exposures to the weather, sun exposure, bodily injury, pesticide exposure. There's a break in their education. Okay, there's a developmental delays. But we do know with migrants that our food supply in the US would likely collapse without the work done by migrant farm workers. Would you guys agree with that? 2 to 3 million of these workers on the farm seasonally are the ones that get the food to our markets. Okay, they don't get workers' compensation, they don't get disability, they don't get health benefits. They're on a daily wage. All right, when they arrive on the farm to work, they may find that housing is not adequate or it's substandard, lack of sanitation, mold, lead, broken appliances, overcrowding. That's a huge issue, overcrowding. Some live in cars and tents. Okay, so when they're living in overcrowded conditions, what are some of the risks?
Tuberculosis.
TB is a risk. What else are risks? Other infectious diseases, communicable diseases, hepatitis, gastroenteritis. Okay, migrants are at risk for, as our rural communities, migrants are at risk for chronic diseases, diabetes, poor dental health, obesity, depression. Right? Kids, like we talked about, they're at risk for malnutrition, infectious diseases as well, dental issues, inadequate immunizations, pesticides, injuries and disruption of their school and social lives due to constant mobility. I would like for you to know about the Migrant Health Act. Okay, this paragraph talks about the Migrant Health Act. Okay, it provides primary and supplemental health services for migrant workers in outreach clinics. Okay, these are federally funded. Because of this act, these are federally funded centers while they're here in the US. Okay. Okay, the next topic is poverty and homelessness. So pretty interesting statistics here. Before COVID, Americans living in poverty were the lowest it's been since 1959, and that was at 10.5%. After COVID, it's now climbed to 17.3%, more than 48 million Americans. With a child living in poverty, the rate is up to 21%. And when I was in my school nurse job for 20 years, the last couple of years with COVID, we saw an astronomical increase in homeless families. with all the things, all the challenges that came with COVID, parents losing their jobs, parents having to quit their jobs to stay home with kids, right? Family homelessness went up dramatically. Okay. What is the meaning of poverty? Meaning of poverty means that you have, and this could be an individual, a family, or a community living in poverty. It simply means that you have insufficient resources to meet the family needs or your individual needs: food, shelter, transportation, healthcare. I mean, many of us are a couple of paychecks away from being in poverty. Right? What contributes to poverty? Unemployment, loss of retirement benefits if a company files for bankruptcy, right? Inadequate education, job training, maybe in some occasions, weak enforcement of child support statutes. Okay, well, and this is important to know. I've highlighted in yellow. Read this. Poverty leads to chronic stress. Poverty leads to mental health issues. Poverty leads to high rates of chronic illness, higher infant morbidity and mortality, shorter life expectancy, more significant disabilities. Okay. Young children, this is important, also highlighted in yellow. Young children are at the highest risk for effects of poverty. Okay. Lack of adequate nutrition, poor brain development, exposure to environmental toxins, trauma, abuse, maybe low quality daily care, right? These kind of kids are going to be sicker at school, have more infections. Okay, they may have higher risk for elevated blood lead levels. Okay, they're usually stuck in a cycle of poverty themselves when they get older due to decreased opportunities in education. Okay, then with regards to teens, poor teens living in poverty, more likely to have below average academic skills, really interesting, 3 times more likely to drop out of school. Higher risks of teen pregnancy. Okay, and with teen pregnancy comes its own set of risks: low birth weight, lack of prenatal care, premature babies, right? Homelessness. What do you guys think about when you, and this is just to think about, what do you guys do in your communities when you drive by homeless encampments or see homeless families living in cars, homeless moms with kids on the street? What do you guys think about?
Very
Sad. What?
Yeah. Very sad, unfortunate. There's also a lot of judgmental and labeling, like they're lazy, they don't want to work, they could find a job, like McDonald's hiring, like all those things that you hear about, a lot of labeling, a lot of assumptions, like a lot of judgment, like judging somebody.
Yes.
So that's very unfortunate.
It's very unfortunate. Absolutely. And we wonder how these people got here, right?
Yeah.
What led to their homelessness? Everybody has a story. Most homeless people don't want to be homeless. From some kind of an event that happened, whether it's an injury from a job or losing a job, or, chronic illness or criminal legal things, or they've been unemployed, they've been laid off, they don't have a regular income, they've lost their home, they can't afford to rent in the area where they live, right? They lost their health care. There's many reasons that people are homeless, right? And we know that with homelessness is a health crisis. There's lots of acute and chronic physical and mental illnesses, right? What support? They don't have a support system, right? Substance abuse leads to job loss, financial difficulties. Substance abuse becomes more important than anything else in helping them get help with that. Domestic violence could be a huge reason for homelessness, especially with women and families, right? The woman has to leave a violent relationship, and often they end up homeless if they can't find the resources, right? Believe it or not, homelessness, the definition of homelessness, it also includes families or people staying with friends or relatives, meaning that they just don't have a permanent place to stay. All right, these are temporary places. That, believe it, that's also considered homeless. We had a lot of families during COVID in the schools I was in that went to live with relatives, went to live with friends, and they were still considered homeless because it was a temporary setup. Okay, we have let's see, staying in temporary shelters, staying in institutions temporarily with nowhere to discharge to. That's considered homeless. Okay, some people are intermittently homeless. Some people are permanently homeless. Some get it together and find a job and are not homeless and then end up back in the same situation. It's really hard to estimate the number of homeless individuals. The latest statistics I've seen is about 625,000 people in this country are homeless every night.
How much?
625,000. That's the latest research I've seen. Then think about it when you are homeless. Think of all the added risks. Being exposed to the elements. You may be living in crowded, unsanitary living conditions, not have adequate food, lack of sleep, chronic stress, right? You're much more likely to abuse substances, have serious mental illnesses. TB is a high risk. Skin infestations are a high risk. Chronic diseases such as diabetes, HIV, COPD, and a higher incidence of being a victim of crime. Trauma is a major cause of death and disability within the homeless population. Gunshot wounds, stab wounds, head trauma, suicide attempts, fractures. And this to me is incredible. The average life expectancy of a homeless individual is 44, as opposed to 78. Amazing.
Oh my gosh, how?
Amazing. So as nurses, what if we're working with the homeless, right? Here's some thoughts. It's vital that we respect the individuality of every person. Many factors contribute to homelessness, and many of us are on 1 or 2 paychecks away from being unable to maintain our daily living or our housing. Right? It's super easy for us, like Yolanda said, to be judgmental, right? Or stereotype, but we will often be wrong. And in the process, destroy any chance of any kind of therapeutic relationship with this vulnerable population, whether it's an individual or a family, right? We cannot make assumptions. The most important thing to do is we have to try and let them tell their story. Everybody has a different story, right? We have to learn who they are, how they got where they are, right? It's so important to establish that respect and trust with this population and frankly, any vulnerable population. Okay, once they see you as a, that you're going to be judgmental and open-minded, then, sorry, I have a bug flying around here. Then hopefully they'll open up and trust you. Okay. And then I'd like for you to read on your own, primary, secondary, and tertiary. Okay. This relates to all these topics we just talked about. It just gives you some examples. Okay. From farm workers to rural populations to homelessness. Right. So have a look at this. Okay, those are your notes. Okay. I want to do does anybody have any questions about those topics? These are hard topics. But if you're in community nursing, you're going to be working with all of these populations. Homelessness is tough, right? Has anybody ever worked with the homeless population before? Anybody ever
Not
volunteered?
directly, but I see them a lot at the hospital. Like we have,
Uh-huh.
I work for non-for-profit
Mm-hmm.
and I'm a phlebotomist. So they have a free public health days
Mm-hmm.
where a lot of people come in and,
Yep.
you know, blood pressure,
Yep.
simple like lab works, like CBCs or BMPs and whatnot, and cholesterols and
Right.
the glucose, stuff like that. So we will usually have these huge meetings with them. Oh, be careful, so be careful this, so be careful tuberculosis, so be careful, just, you know, because you don't know where they're coming from. So of course you have to be careful with everybody just across the board. But especially in those days, you have to be unfortunately extra careful just for those reasons.
Right.
Yeah.
I'm going to give you guys, I'm going to put in the chat. Hang on. Let me find it. I'm going to put, nope, that's not what I wanted. Hang on. God, I had this pulled up. I'm going to pull up, cap. I'm going to put this Jamboard in the chat. Okay, and I want you guys to open it. All right, this is just a quick review. Okay, chat. No, how do I do this to everyone? Everyone. Oh. There we go. All right. You guys pull this up. I'm going to share it. It's in your chat. Can you guys see my screen?
Yes.
Okay. This is from my Monday class, so we're going to add to it. Name 3 factors that make rural residents, and you have to follow along with me going from slide to slide. Name 3, or we could clear it. Oh, I didn't mean to do that. What was the question? Name 3 factors that affect rural populations. So what you do is you come over here, you take a sticky note, and you write transportation. Transportation. And you save it, and it adds it into a sticky note into the Jamboard. So I accidentally deleted the topic, the question, but it is name 3 factors that affect rural population. So give me some sticky notes and let's put them in there. This is just a review of what we just went over. I just put in transportation. You guys know what to do? Pull up a sticky note right here on your left-hand side. Does anybody want to add to this?
I'm thinking of what to put.
What? Okay. What about lack of specialty doctors?
Insurance.
Lack of service, lack of insurance. Yep. No medical coverage. Excellent. Excellent. What else?
Knowledge.
Yep. Lack of knowledge, lack of education. Let's go to the next frame, number 2. Let's add to this if you would like to. Name 3 illnesses more likely to occur in rural adults. So far we have cancer, stroke, TB, diabetes, pneumonia, lead poisoning. What else?
Where do I drag the sticky?
What? Right over here. Look on my screen, right over here. Left-hand side, there's a little notepad with the right bottom flapped up.
Yeah, but where does it go?
You just click on it, write something in there.
Oh, okay.
I'm adding one now. I'm adding COPD.
Okay.
Okay, I just add COPD. What else do we say? Hypertension. Somebody want to put in hypertension?
Gastroenteritis.
What else? Name 3 more illnesses.
Gastroenteritis.
What? Gastroenteritis. Absolutely. Okay.
How do I drag obesity in there?
Pardon me?
Obesity?
Obesity.
I
Is that what
put
you
that in
said?
there already. Yeah, I
Okay.
put that one in there.
Great. All right, let's go to screen number 3. What are the high-risk industries in rural populations and why are they high risk? I'm taking this out because I want you guys to. So put your stickies in. There were 4 high-risk industries. What were they?
Farmers.
Forestry,
Forestry, farming.
Immigrant workers.
Yep. Can you guys not write these on stickies and put them in, or are you just talking out loud? That's the whole fun
My
of the
internet
gym.
went out when you guys were doing this, so I don't even know how to do it. My laptop just went dead too, so I'm charging it.
Okay, we're taking stickies from over here. The link to this Jamboard is in your chat. We're taking the stickies that are over here and you click on it. It's going to give you a space to type in an answer to this question. You just hit enter and it pops up here. Like somebody just
added
put in
marine.
farmers. Farmers, forestry, what else?
I added Marines.
Okay, great.
Can someone put children for me?
I'll do that for you. Children. Excellent. Yep. Children. So can you see my screen where it says farmers, children, and forestry? Okay, let's go to screen 4. You have to keep following along with the slides. I can't change the slides for you. So we're on 4. Symptoms of acute and chronic pesticide exposure. Name 3 of each. That was highlighted in yellow on your notes. What are some symptoms of acute and chronic pesticide exposure? Memory loss, good. Acute memory loss, good.
The lung disease.
Yeah. Lung disease, cancer for chronic. Mood changes. Yep, twitching muscles. What about acute? There's itching of the throat. There's throat discomfort,
Those are more
coughing,
than allergies, right?
allergy.
Well,
Yeah,
those are more than allergies. Like they're not your seasonal
Yeah.
allergies. They're just something
Yeah.
that they have to deal with.
Yep.
Yeah.
Yep. Birth defects, great. Skin rashes, cough is another one. Blood disorders, excellent. Look at all these answers. Great. That's awesome. Let's go to number 5. Everybody go to number 5. I actually want to delete these. I should have already done this, but I didn't. What is a migrant farm worker and what is their job in the US? Do your sticky notes. Seasonal, great. What else? Working in farms, excellent. Working in farms. Well, what is a migrant farm worker? See, we said seasonal. Yep. Immigrants usually. Yep. Good, good. Okay, let's move on to number 6 because we have 16, I believe. Which federal law, which federal law provides funds for the health care? And what government support do they qualify for? We're talking about migrants. It's in your notes. Migrant Health Act. Okay, everybody remember that from your notes? Okay, move to number 7.
I had a question about that real quick.
Yep.
Would that be in the study guide,
What?
the Migrant Health Act?
Should be.
I can't find it in there.
Well, know it from your notes, okay?
Are the notes that you were just reading off different than the study guide?
Yeah,
Like
your
you sent those?
the notes are your weekly notes. You've gotten weeks 1, 2, and 3.
Oh, okay.
We have taken off the notes what you need to know for the exam,
Okay.
and that's in your study guide.
Okay, perfect.
Okay. Name 3 illnesses migrant farm workers are at risk for. I have TB. What else? I'm going to put one in there. Hepatitis.
That's
Right?
what I was putting in right here.
Oh,
Hepatitis.
sorry.
TB.
That's okay.
Poor dental, hepatitis, TB,
Yeah.
gastro issues, sure.
Communicable diseases.
Communicable
Respiratory.
diseases, respiratory, absolutely, great.
Lead exposure.
Lead exposure, pesticide exposure, right? Okay, number 8. Name a secondary prevention community nurses screen for in migrant farm workers. What do we screen for in migrant farm workers? Secondary. Blood
Diabetes.
Yes. TB.
Hypertension.
Hypertension. Yes. HIV. Absolutely. Any kind of communicable disease. Maybe STDs as well. Hepatitis. And remember, secondary is screening. Pap smear. Yep. Good. Okay, number 9. Name 3 factors that lead to poverty. Well, there's a lot more than 3, but let's name 3. What factors lead to poverty?
Education.
Loss of jobs.
Loss of employment.
Mm-hmm. Yep. Lots of factors lead to poverty.
Health.
Living in a rural
Health
community.
issues.
Right? Yep. No education. Yep. Loss of job. Maybe the community that you live in. Right? Let's say you live in a community that's riddled with crime and there's not a lot of resources. Addiction, mental health. Yeah, absolutely. Yep. Okay, let's do one more and then we're going to do the quiz. Okay. All right. Name 3 factors that lead to teen pregnancy.
Poverty.
Maybe lack of support,
A lack of education.
lack of education.
For sure.
Absolute peer pressure. Right?
Drugs.
Drugs, exactly. So was that helpful? Did you like that? Yeah. All right, I'm going to give you, I'm trying to time this so we're right on the hour. So what time is it? 2 o'clock? Right? So I'm going to give you 15 minutes to do your quiz. Okay?
Okay.
It's proctored. I mean, I'm going to go off camera and mute myself, but everybody needs to do quiz 2 now. And then if you get finished before 15 minutes, you know, you can stay on camera or stay on, but go take a break or whatever. But some people do actually take up to the 15 minutes, and I want to allot that. And then after that, we'll spend the last 15 minutes going over the quiz. Okay? All right, so go ahead and start quiz 1.
Do we submit it or we don't
Yeah,
submit it?
absolutely submit it. You got to submit it before we can start going over it. Yep.
Okay.
All right, so you guys start working on it. I'm going to mute myself and I'll see you in 15 minutes. How's that?
Perfect.
Take your time on the quiz because believe it or not, I know it's only a point for each quiz, but you know, I want to make, yeah. And this
It
is a
is
good, this is a good quiz. You should.
Oh,
All right, we'll see you in a minute.
okay. I know where you went. You're not here today.
It looks like I still have a few more students still taking it. Right? Dorinda's taking it. Anybody else still taking it? Shanti, you still taking it? Okay. Got about 2 more minutes. Shanti's done. Okay, so Dorinda, we're waiting for you. Okay. Dorinda, you okay? All right, I'm going to share my screen and let's review it. Okay, and it gives you your score, but it doesn't tell you the questions you got wrong. Is that right? You should, or do you have
No,
the
mine
questions
told
you got
me.
wrong?
I was able to see what I got wrong.
Okay, great. All right. How'd you guys all do? Better than last week?
Yes.
Was it helpful going through all the information ahead of time and then doing that little Jamboard to review everything?
Yeah, I do have a question about the last one though. That
Okay,
makes
let's
sense.
bring
Yeah,
that up when we'll
right.
I know the one you're talking about. All right, I'm going to share my screen. Let's do the quiz. Okay. What should the home health nurse anticipate about the clients in very rural communities?
First one.
Anybody have a different answer than that? They will be more likely to have complex chronic illnesses. Why?
The lack of insurance, lack of transportation, lack of knowledge.
Yep. What's the other big one? They're less
Money.
likely to seek primary care.
Yeah.
Right? So that when we do see them, they're more likely in a more complex stage of their chronic illness. Right? And we know that the other 3 are exactly the opposite. Most of them will not have employer insurance, right? They will be more likely to have environmental exposure. Most of them will have less adequate access to physicians. So the other 3, the opposite. Number 2, the nurse is developing a primary prevention program for members of a rural community. Which intervention is appropriate?
Second.
Right. And why is that primary?
Because it's the prevention. It's the you can prevent, like you can explain what it does to
Yep.
before it's too late. So
before anything happens. What is
Right.
number 1? What level of intervention is number 1?
that's the
Anybody?
Primary.
Nope. What's number 1?
Secondary,
Secondary. Why?
because it's a screening.
Right. You're encouraging them to do annual screening. What level is number 3? Educate families on diabetes related foot care. What is that?
Tertiary.
Why is it tertiary?
Because they already have a disease.
Exactly.
So
Does
you're just
everybody understand
educating-
that? Yep. They already have something. In order for tertiary interventions to be put in place, they have to have something. A disease, condition, issue. And then what is the last one? Organize a blood pressure screening at the mall. What level of intervention is this?
Primary.
Nope. What's
Secondary.
screening?
Secondary.
Secondary, because it's a screening. It tells you organize a screening. Remember, secondary, early identification, early intervention. That's screening.
So that's secondary.
Correct. Yep.
Okay.
Primary is prevention, secondary
Yeah.
is screening, tertiary is treatment.
But when you're screening, aren't you preventing it? Like if you find out during screening, okay, I have a high blood pressure. Okay, but then you already have it.
Right.
Right. Okay.
A migrant farm
Okay.
worker, a migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, of cough. Which nursing intervention is appropriate?
If they apply chemical pesticides.
Okay, everybody agree with that? Okay, because that's what we're talking. One of the biggest risk for migrant workers is pesticide, working on farms is pesticide exposure. These are acute symptoms of pesticide exposure, which we just talked about. During a home visit, the nurse notes that the migrant farm worker's family is living in a small house with several other families. Which nursing assessment is priority? What's the important word in this question?
Small house.
Nope.
So it would be no. Oh.
Nope. What is the most important word in this question?
Migrant farm
Nope.
workers.
Priority. Priority.
Ah, priority. Okay.
Right? Because what happens, look at this question. What happens if you can only pick one answer and there are 2 or 3 answers that look correct? What should you do? Go back to the question and see if you missed a certain word or cue or phrase. Okay? So some of these other answers could be, yeah, you could do them, but what is the priority? What are we looking for? Yes, you know that migrant farm workers working in small house, that's a cue. Right? But what's the most important word? Priority. So what's the answer?
The last one, the tuberculosis.
Correct, because we know that migrants living in small house with several families, there is an increased risk for TB. So that is the priority. Okay, the other ones, A could be okay. Assess to the consumption of food. Right? Their ability to travel into town for healthcare services. Sure, we can assess that. But what's the most important thing to assess first? TB screening. Does that make sense? Okay, which statement reflects the impact of income on health outcomes? What's the right answer?
Low income increases the risk of chronic illness.
Right. Everybody understand why that's correct? The other 3 are just the opposite. What should the nurse anticipate for a family living just above the federally defined poverty line?
It's a
The
15
first
months old.
I'm sorry, which one?
15 months old.
Say
But
that
it is
again.
15 months old infant without the medical history.
Oh, no, I'm up on number 6.
Oh,
Which should the
6.
nurse anticipate for a family living just above the federally defined poverty line?
I picked the first one.
Yeah, anybody understand why the first one's not correct? You're certainly going to have increased vulnerability due to fewer community resources. Right? So everybody understand why that's correct? Okay, question 7. Who's the most vulnerable? Which client is at the highest risk for adverse health outcomes related to poverty? This was in your notes.
15 months old infant without medical history.
Yep. Tamara, tell me why. You're muted. You're muted.
At that point, a lot of things could happen because, I mean, from infant to 15 months without having, the medical history behind it.
Yeah, one of the things mentioned in your notes was inadequate immunizations. Right? Well, if they don't have a
Yes.
medical history, how do we know they've been immunized against anything? And if they're not, what are they at risk for? Okay. So a 15-month-old with no medical history is a high risk person, baby. And again, in this question, what is the most important word?
Highest risk.
Highest. Okay. These other ones could be at risk, I guess. 19-year-old with a history of asthma, 68-year-old with type 2 diabetes, somebody work at 44 working on a farm. They could all be at risk, right? So here's a another example of you read a question, you say that there might be more than one right answer, but I can only pick one. Please go back to the question and see the word you missed. Highest risk. If it just said which client is at risk, it could be all of them, right? But now that they said highest risk, right? It's certainly the 15-month-old. Number 8, which would the school nurse expect for an impoverished adolescent? Hang on one second. What's the answer to that question? Which would the school?
Increased risk of dropping out of school.
We just talked about that in our notes. What are some of the high risks for adolescents? Pregnancy, and they have 3 times more chance of dropping out of school.
Yep.
Right? We just talked about that. Number 9, which client is at the highest risk? The highest, again, a keyword. Which client is at the highest risk for homelessness? They're all at risk, actually, but which one is high? The highest.
I picked the veteran.
The post-traumatic.
And why? Why is B the right answer? Number 2. As opposed to the others.
I picked that one because he's the only one that's living alone.
Exactly. Good job, Gabrielle. Exactly. The other ones are at risk, but it looks like they have a support person or somebody living with them, or they're living in a group home.
I was
Right?
going back and forth with older child with a history of suicidal ideations, but then I picked the veteran.
Yep.
But the older child, we don't know he's because older. I was like, well, is he by himself?
Right.
I don't know. It's just what, but the veteran seemed better. I don't know.
Right.
It seemed
No, but
better
the
to-
veteran who has PTSD and
Yes,
living alone
yeah,
for right now is the highest risk of that group.
yeah.
And then last question, the nurse is working in an outreach clinic in a homeless shelter. Which client should be prioritized?
See, I picked the worsening foot ulcer, but that's not correct.
Correct.
She here already?
And it does
complaint-
confuse me.
It's asking, there's
Oh,
another
shoot.
keyword.
Are you?
Um,
Oh, I see Grandma Nancy. She asked about
complaints with
everybody. And I seen Lucky. I'm like, what?
Okay.
My
So
sympathy. Yeah,
again,
somebody talk about me now.
another example of a question that all the answers could be correct.
So
They're
mean.
asking you to prioritize what's the most
Girl.
urgent.
But I was thinking because of the ulcer, I was thinking maybe infection.
Yep.
So
Right.
I didn't understand why that would be more important than.
Well,
Just
what is
is-
what could A be a immediate symptom, signs and symptoms of?
TB.
Correct. And what's the environment?
A homeless shelter.
Crowded and populated.
And what is one of the biggest risk factors in this setting?
TB.
Correct.
TB.
All right.
Okay.
Infection is important, as is frequent
Yeah.
urination, as is difficulty sleeping due to panic attacks. This is a question where everybody
Mhm.
is at risk. but it's asking what should be prioritized. And the signs of TB, the complaints of night sweats, unexplained weight loss takes the priority. Not to say that worsening foot ulcers and purulent drainage aren't a priority, but that can be dealt with. Let's figure out why the person is having night sweats and unexplained weight loss and figure out if they are positive for TB. So that's the priority.
See, I was thinking if they become septic, I was thinking like infection,
right,
and the fever and the sepsis and all of those things.
Right.
That's why I picked
right
the foot ulcer. And
right.
when they came up incorrect, I was really shocked. I was like, what?
Well, yes, that it could. Yes,
They're
that
putting
could
everybody
be
else at risk with the TB.
correct.
Right.
That's correct. Thanks, Caitlin. Yep.
Thank you.
So how'd you guys do? Does anybody have any? Did you like the way we did that? To go through everything first, and then we'll do the quiz. We'll do that going forward.
Very nice.
Okay. Okay. I can't do anything about last week. Apparently there were lots of issues in every class about taking quizzes at the beginning. Dean Brown gave each of us, or each class, the ability to be flexible. So I reached out to the other professors in our sections and we all agreed that we would do it this way. So everybody's doing it this way in this community class going forward. Okay. So I hope that helps. So that's all I have for tonight. Today, excuse me. Does anybody have any questions? This is this is exam preparedness week. Okay. So again, I do have an email from Dr. Kershaw that I do have her recording in my email somewhere. So I will post that along with the recording for tonight's class. Okay. Her recording of the exam review.
Thank you for having me.
Oh, yes. And I already sent a message to Dr. Kershaw while you guys were taking the quiz that you were here with me tonight.
Thank you. I will email her as well.
Yeah.
I don't know what happened. Thank you
That's
so much.
okay.
Okay.
It's good to see everybody. You guys know where to find me if you need anything, right?
Yeah.
Okay.
Yes.
All right. Well, have a good weekend.
You too. Thank
You too.
Bye.
Bye.
Bye.